board to you this morning. Our first goal is our safety goal, and it's related to our total joint patients. We want to be able to see 75% of the patients on post-op day 0, so the afternoon of surgery, we'd like to see them. We did have 2 surgeries yesterday, and we were able to see both of our patients, so we were green for the day. And as you look above, I did put Novembers up there too, so you could kind of see where we've been and where we're trending. Our productivity goal, it incorporates both PT and OT, and the goal is that each rehab discipline will see a minimum of 6 billable visits per 8-hour shift. So we do a little math with this one, and we want to score at 0.75 or higher. PT team was at a 0.8 yesterday, so we were green for the day, and the OT team was very close at a 0.7, so just a little bit below goal for the day yesterday. One of our delivery goals is that all total joint patients with a discharge plan of going home will graduate from PT on or before post-op day 2. And we were able to meet that goal yesterday, so that one was green for us. Let's see, our other productivity goal is that all total joint patients will be ready to be seen at the time of their rehab appointment. And as you guys will notice, we do share this one with the OSU unit also. We did have a fallout yesterday, so we weren't at 100%, so we did make us red for the day. And then when we look down to our Pareto chart, we can see why the fallout happened. And there was apparently a patient that was getting a bath by a family member. So probably not something that's worthy of an action plan, but it does bring it to us, our awareness. We can have that communication with the OSU staff. You know, maybe a reminder to use temp rounding and kind of cue patients up, like, you know, we really would like you to be ready for that appointment when it's time. So what kind of questions do you guys have?
So how does your team come up with its action plans?
We struggle a little bit with that. We meet daily, so a lot of our action plans just become just do-its. You know, we meet in our triage meeting, we throw around a couple ideas, and then we fan it out through the rest of the team. That's how most of the changes come about for us. We have done a couple though that, you know, the executives kind of give us a couple ideas when they're here and challenge us with some questions and think about things for us to think about from that way too. Our safety goal has changed from the time we started. So this one's been in place since March. At first, we were trying to see patients by 3 o'clock. So we figured out that was a little too inclusive. So then we changed it to 3:45. And again, we needed to change it a little bit after that. So then we incorporated going up to the PACU or OSU to see patients. You know, and we still get a little pushback from the executives. What else can you do? What else can you do? So in 2014, we're going to do a trial of changing some PT hours to see if maybe some later hours will help us to capture some of these patients that are coming out of surgery later. And so currently, we are each assigned a day of the month to present the board. And the way that we know that we're ready to present the board is we have to go through a little mentoring program. So if someone was new, we would bring them in, they'd watch a current employee do it, and then they would have an opportunity to do it while that other employee watched, and then they'd be set off on their own. So throughout the day so that it's a very easy process for us. The PTs are paired with one of our patient care assistants who carry these forms around with them throughout the day. And then it's a very easy circling yes or no basically kind of questions about whether they were ready or not and things like that. So then when we put this in a central location at the end of the day and we can compile the data pretty easily. And then also we've incorporated some help from the PACU. We send up a list in the morning of the patients that we are looking for throughout the day and ask the unit clerk to then send a page out to the PT staff when that patient hits the PACU. So basically we know then within an hour or so they would be ready for a PT eval.